Hello all. We'll start on time today. This webinar is recorded and we'll send the recording after the call. Today's topic is from monitoring IVF to opening a fertility clinic. And we'll have a discussion with Samantha Stern here about her experience in this area. Please submit your answers in the chat or unmute or raise your hand to ask a question. My name is Anya Kern. I'm a co-founder and CEO of Blooming Eve, a health tech startup that helps clinics run their operations more efficiently and improve patient experience. Today's conversation is about our new program, Remote IVF Monitoring. We are launching this program at the end of the month, and the first participants are free to sign up. In a nutshell, the program involves connecting clinics that can do follicular counts through ultrasounds and with the fertility clinics to help their patients with part of IVF, which is called monitoring. Samantha Stern, CEO of Annandale Fertility Clinic. She will share how her clinic benefited from participating in a similar program. Samantha Stern is a Baltimore, Maryland native. She obtained her Master's of Medical Science from Wake Forest University in 2018. Samantha has been participating as a PA in women's health for the last 6 years. She began her training in inpatient obstetrics at NYU Langone Hospital in New York City and has been working at an Annandale OBGYN, a private practice in Northern Virginia, since 2020. Annandale OBGYN is privately owned full-service women's health clinic with 4 locations, 11 providers. In April of this year, she and her partner, Dr. Anna Lee, opened Annandale Fertility, a full-service IVF clinic in Fairfax, Virginia. Samantha, thank you for joining.
Thank you so much, Anya. I really appreciate you inviting me to speak today.
Yeah, I'm excited to jump into the conversation. If anybody has any questions, please leave in the chat box or raise your hand. But to start from the beginning, what inspired you to start offering your patients IVF monitoring services?
So we have been doing IVF monitoring for about 4 years. So I was an employee at Annandale OBGYN, which is a really robust private practice. It's been in practice for about 20 years. And Annandale OBGYN is unique in that we do a lot of ultrasounds for our patient. So it was COVID, and we are right in the backyard of Shady Grove Fertility, which is the biggest IVF clinic in the country. And Shady Grove Fertility used to offer remote monitoring to their patients. And then COVID happened and they stopped. And patients were scrambling like mid-cycle, and patients who had, cycles coming up. And it was a big problem. And actually, funny enough, we had a patient who had been a longstanding patient of ours come to us, and she said, "Why aren't you guys doing this? You have ultrasounds in every room. All the providers are trained on ultrasounds. Follicular count is not that difficult. Why don't you start doing it?" So we started with one patient. She was actually one of the first patients I had on my very first day working at the private practice. And since then, we've seen what a huge need it is and what a huge benefit it is to patients who are going through IVF cycles. So over the last 4 years, we've really just been building out the program. And since then, it's actually led us to opening our own IVF center.
It's so inspiring. Lovely. I love how the patients drove the change pretty much. Yeah. And definitely COVID, however terrible it was, it did accelerate a lot of good changes in healthcare, especially. Yeah. So I'm happy to hear that you were able to carry on this.
And fertility patients are amazing because they're really well educated. They're great advocate for themselves, and they talk within the fertility network. So they're really great patients and kind of like helping to inspire the change that is needed within the reproductive endocrinology specialty and industry.
So I'm wondering, as far as I understand, you're a very patient-driven, pretty straightforward
Mhm.
clinic.
Mhm.
How did your experience changed in terms of patients obtaining their care? So did anything change from the patient perspective, how you did the services?
Do you mean specifically as far as like how it went through for their cycle, or what do you mean specifically?
Yeah, how did the patient experience change at your OBGYN clinic, starting from their first discussions about fertility? How did you give them the choices for fertility treatments and so forth, so on? Did anything
Yeah.
change?
So the IVF monitoring is really kind of what inspired everything. I mean, before then, we were still doing kind of the basic fertility workups and ovulation induction with letrozole and Clomid. But when you start doing IVF monitoring, you learn a lot through osmosis. You learn about what's important during the ultrasound. You learn about what's important on blood work, when the patients are coming in, why they're coming in. And again, they're great advocates for themselves. So they can tell you, hey, you're not doing this right, or you are doing this right, or I need this, you need to include this on the report. So, you learn a lot just by osmosis. And if you're someone who's curious and interested about the specialty, you ask questions to the patient. So I'd say, what medications are you on? What doses are you on? So kind of just over the last 4 years, we've learned a lot by osmosis. That's kind of what drove us more to be doing more fertility. We started doing IUIs. We had a relationship with a fertility clinic in New York, CNY Fertility, that Dr. Robert Kiltz owns, and he actually, is such a generous guy and was willing to train us actually on how to do these ultrasounds and what's important. And so that's kind of how the whole process started. But the patients love it; they're so grateful. It's an emotional journey that these people are on. So being able to offer this really important service so that patients don't have to like take a month off and go move to, another city. I mean, I don't even know how people have the time to do monitoring. It's such a time, demanding thing. So, patients just love it, and it's been great for them.
That's amazing. And it's great to hear that you were able to get the training from the fertility clinic, the first ones that you started partnering the most. So, did you start using any different technology or change your workflows in operations by any chance when you started providing IVF monitoring?
Yeah, so that's a great question. So we have Samsung HS40 ultrasounds in all of our exam rooms, and they're great. They're kind of like a little bit more basic on the ultrasound side, but they completely get the job done. I mean, you don't need these $100,000 GE, ultrasounds by any means. So we had these ultrasounds kind of already in place. What we had to do was when we really ramped up the program, we had to speak with the Samsung reps and kind of finagle the ultrasound like programming to be compatible. So, a lot of them don't come automatically preset with like being able to measure follicles, for example. So I had to call up the Samsung rep and say, hey, let's include, 30 follicles that I can measure on each ovary. And we changed some presets to be able to really see follicles well, really see the endometrial lining well. So that was a small change that we made. If you already have the ultrasounds in place at your clinic, whether you're doing it or whether a sonographer's doing it, that's a really easy change. I mean, if you don't have the ultrasound and you're not someone who's comfortable ultrasounding, then obviously there's a bigger hurdle there. But from a technology standpoint, it was very easy. From the patient flow standpoint, when our numbers were very low, it was pretty easy. We were just kind of scheduling patients as regular appointments. As our numbers have ramped up, and now we're doing anywhere from like 8 to 10 monitoring patients per day. So because I'm the fertility person, I actually block off my first 2 hours every morning, and I only see fertility monitoring patients. Unless there's some major emergency, I do not see any other GYN patients or consults or diagnostic testing, because the monitoring patients need to be prioritized, because the blood work is really important for IVF. And, the hormone testing the hormone testing plus the ultrasound dictates everything. When do you trigger the patient for retrieval? When do you start them on progesterone for transfer? Do you go up or down on meds? So the lab work is really important. So the lab work really needs to be done before 10 a.m. If you send it out stat, there's usually about a 4-hour turnaround time that we found with LabCorp, that if we order it, we get the labs back. And the majority of the IVF clinics want it back by 2 p.m. Now, none of the clinics close at 2 p.m., but the nurses have to speak to the physicians and they have to call the patients. So, they want to get out of there by 4 or 5 o'clock. So what we do is I start seeing patients at 7 o'clock every day. My first 8 patients, and I end up double booking. We see more than that, but usually 7 to 9 a.m. I'm only doing monitoring patients. So that flow has changed, and we've had to speak to our call center, our front desk, our schedulers about that, and change things on the back end of our website. I can't, patients aren't allowed to schedule themselves. Basically, it all has to be done through the call center. So the appropriate patients are being scheduled at the appropriate time.
Mm-hmm. Very interesting. And with the ultrasound results, did you decide to provide it to your patient right away after the appointment, or do you send them on your own to the fertility clinic? How do you go about that?
So what we've done that we found works really well is we put kind of the impetus on the patient that I'm going to give you a copy of the ultrasound and you make sure that you upload it to the portal, because sometimes in our system, fax numbers aren't correct, or faxes don't go through, or the person's not checking the email, what have you. So what we've done is we put the impetus on the patient. Now, because we're all providers doing the ultrasounds, it's nice because I can, instead, sonographers, they have to have the physician or the provider review it before they can communicate what they're seeing to the patient, right? So as providers, us doing our own ultrasounds, I actually do the ultrasound with the patient. So I always turn the screen to the patient. I show them the follicles that I'm measuring. They're seeing how many follicles they have on each side. They're seeing the measurement of the lining. And I think that really instills confidence in them that we're getting the appropriate measurements. We're doing it accurately. We know what we're looking for. We know what we're doing. So right after, we're basically, I'm walking them through the ultrasound the whole time I'm doing it. So they know exactly the measurements of every follicle they have. I print out a copy for them. I print out a copy for me. We hand the copy to them, and then it's their responsibility to get it to their clinic. For blood work, what we do is the blood work orders go in stat. And we are lucky in that we have LabCorp phlebotomists at every one of our locations. So they're ordered stat on our end. We make order sets for this, so it's really easy. I have a patient who come in, I just click, I know what they need. And then the phlebotomist actually will ask the patient, hey, what clinic do you need this to go to? And we have a list of the typical IVF clinics that we monitor for, and we actually send it to them. Now, again, I always say to the patients, double check, make sure it's there, sign up for a LabCorp portal or whatever, lab system you're going to use, so that, the responsibility is on them also. Just backing up a minute. So the patients also have to bring in with them every time they come in a hard copy of their order set. So we need to know what clinic they're with, what's the fax number, who's the ordering physician, what's the diagnostic code they're using, what do they need from an ultrasound perspective, and what labs do they need. The majority of IVF clinics do the same thing as far as labs, but not all of them do. Like, I have some clinics that order an FSH on every single patient every single time, and then I have other clinics that don't, so we need to know what the clinic needs for each patient for each monitoring visit.
Makes total sense. And actually, that's exactly why we wanted to help to be intermediary between the OBGYNs and fertility centers, because we wanted to standardize the way the documents are sent from one side to another and offload the patients, because they have a lot of new things to learn during the IVF process, and it's stressful in itself.
Yep.
And basically navigating this journey, is extremely daunting. So we wanted to alleviate their administrative burden that is just sending the documents back and forth, and we're all finding the clinics too where they can do the monitoring in the first place. So that's definitely something that is aligned to what we are trying to do.
Yeah, I think you guys creating this program for monitoring is going to be great for patients, and it's going to be great for gynecologists or even radiology centers who are more interested in learning this and are seeing these patients coming out, but they don't know where to get started, and they don't know kind of how to, a lot of us doing this was trial and error, and we've, I think, perfected it now. But you guys kind of rolling out this program, hey, let us help you, we're going to kind of standardize it for you, is just going to be great for patients and for providers.
Yes, exactly. We are trying to make it as easy as that anybody who wants to participate will just make sure that the process is smooth for them, so that we can implement the changes. Like you mentioned, there will be changes that need to be done within the clinic, so we can help them in every step. So I'm wondering, in terms of the follicular studies, did you have a lot of experience going into this? How long did it take you to be extremely comfortable as a practitioner to do the follicular studies?
I think it depends on your comfortability with doing gynecologic ultrasounds. Now, measuring follicles is not hard. If you can measure an ovarian cyst, you can measure a follicle. It's basically the same thing. What we kind of did, I already mentioned our relationship with Dr. Kiltz, and Dr. Kiltz is amazing because he's really generous. And I think a lot of clinics are very closed off and keep their information on what they do private. They look at kind of the fertility industry as a competition. Dr. Kiltz does not look at it like that. And I don't look at it like that because, there is such a huge demand and a huge need for, fertility services. And we always talk about, among me and my partners, that we're not taking a piece of the pie in Northern Virginia. We're just expanding the pie because, we're doing about 3 million IVF cycles in the country right now a year. We need millions more. But anyways, we have this relationship with Dr. Kiltz. We're very lucky, and our providers actually had the opportunity to go up to his clinic multiple times and learn with his nurse practitioners of basically if we're doing this right. It was kind of self-taught in a way, but we quickly wanted to make sure that we were doing it in the same way that IVF centers do it. And this is something that can really be taught pretty easily, I think, through someone, remotely watching how an ultrasound is done, or YouTube. It's basically, you kind of scan through the ovary. I do kind of a quick assessment of how many of the follicles the patient has. If a patient, has diminished ovarian reserve, it's actually much easier because if they have fewer follicles, there's fewer to measure. It's much harder when you've got a PCO patient with huge, really well stimulated ovaries. It's really kind of easy to get lost in the follicle that you're measuring. But basically, you land on a follicle, and we only measure it length width. We don't measure it in 3 dimensions because the follicles are so small and it's so easy to kind of get confused. But you find the follicle, and I always start anterior and just kind of work my way posterior, and you just kind of freeze it on the largest diameter of each follicle. Now, there is some technology coming out that if you have 3D ultrasounds, there's a company called Cycle Clarity that's come out, where if you have a 3D ultrasound, you really just put the probe in the vagina, find the ovary, and it scans the whole ovary for you. So it's a great technology. It works. Apparently, the accuracy of it is great. So that's always something that clinics, if they feel a little bit less comfortable with the ultrasound, they could always implement that too. But I think the follicular study is something that's really easy to learn if you are comfortable with pelvic anatomy and you're comfortable with ultrasound.
Makes total sense. Yes, we know that folks from the Cycle Clarity, they're great, especially to start with, if you need a little bit more of training to understand how it works and just to bulletproof your own vision. And I think it's still great to have the skill of knowing how to do it on your own. But if you're a little bit unsure, the tech can help you make more confident decisions.
And we're always happy, if there's providers who are interested in learning how to do follicular monitoring, ultrasound monitoring, I'm always happy for you to reach out to me directly or Dr. Annandale directly. And you can always come to Virginia for a couple days and observe, as long as the patients are okay with it. But it's really not a hard thing. I think like a couple ultrasounds, you watch it, you get it. So I would love for anyone who's interested in watching this to come down to the clinic and kind of learn more about our process and what we do.
Definitely. It's so nice of you to offer that. It's very generous. Actually, I wanted to talk about this as well. What was the pivotal point that you decided to open your own fertility clinic? When did it happen?
It was about 2.5 years ago. We've been doing monitoring for over 2 years, and we've been doing IUI, ovulation induction. We've gone to a number of IVF clinics. We've been making relationships kind of in the reproductive endocrinology world. My partner, Dr. Annandale, has an IVF baby, so she went through the experience herself. And, we have an interesting model in that we have an IVF center, but we also have an OBGYN center. And as OBGYN providers, we have this very intimate relationship with our patients that we have a lot of continuity. So just being OBGYN providers in the area, we kind of hear everything of, positives and negatives that patients have had at other clinics. And we're seeing over and over the huge amount of need that even in our area, in the DMV area outside of DC, there's a number of IVF clinics here, but there's so many patients that need fertility services. And we were seeing 3 to 6 month wait lists at these huge centers. So I don't know if there was like one pivotal moment, but I think just seeing the need and learning so much about these other centers and what works and what doesn't work, and how we can give back and what we can do well and what we can, work on. And we got into this really, and our prices are like 20 to 30% of the 30 to 50% of the average in our area. And we really got into this because we wanted to help our patients, not to make bajillions of dollars. So that's why we did it. And then it did take us about 2.5 years to open an IVF clinic. And I will say it's not for the faint of heart. I've got a number of gray hairs to prove it. But it's amazing. And, when you're really able to help patients like make their dreams come true, it's fulfilling in a way that I haven't been fulfilled. And I love women's health. I love OBGYN, but there's something so incredibly fulfilling about helping patients achieve their dream of having a family.
Yes. Oh, it's having goosebumps too. It's it's amazing that you are helping so many people now to conceive as well. And in terms of your experience on the financial and insurance side.
Mm-hmm.
So insurance is notorious for kind of non-identifying IVF monitoring as either it should be covered or not covered by regular insurance. Definitely gray area here. How do you navigate this? And overall, how did the IVF monitoring impacted your finances on the OBGYN side?
So basically what we do when a patient is a new patient and comes to the clinic, we verify their insurance and see what their benefits are. So before we opened IVF centers, it was specifically for ultrasound monitoring to see if the monitoring was going to be covered. And for the patients it wasn't, we have a self-pay package price. So we charge $999, and that includes any number of ultrasounds that they need in that cycle. So if they need 10 ultrasounds, which most people don't, or if they need 2, then that's what we charge. So we have the self-pay package, and that was just an easy way to standardize it. I certainly think over the last 4 or 5 years that we've been doing this, the insurance coverage has been a lot better, and our reimbursement has been a lot better. The federal employees just got like great coverage of fertility benefits and medication. So that's, a huge number of patients in our area. But so that's kind of our self-pay pricing. On average, actually financially, it's pretty good. We make about $150 to $350 for each ultrasound monitoring visit that's paid back from insurance. So the average is about $250 per patient. Which is really not bad. So there is a financial benefit to doing the ultrasound monitoring. But beyond that, we've had so many patients who love the service that we provide, are so happy with us just generally. Now we have patients for life. They're coming to us for their pap smears. They're pregnant. They're staying with us for their pregnancy. And that has been, I think, where the financial benefit has really had a positive impact, because these are patients who we did no marketing for. Most of these patients are word of mouth, or they found us from their IVF center's website, or really the main way that patients have found us is there are big, from what I understand, Facebook groups that fertility patients in certain regions use. So apparently there's this like huge fertility DMV monitoring Facebook group. And, as we continue to do this and we've built up patients, our name is on this. And, oh, I go to Sam and she's great. And, oh, I know Leah's on the call. Leah's one of our PAs and Leah's great. And so go see Leah for your monitoring. So we've had free marketing. Patients come in, we're able to bill for the monitoring, and then we have patients for life. So it's been really actually pretty beneficial from a financial standpoint.
That's amazing. Whenever there is a Facebook group that does something on its own, it's like a wave. It's going to take over everything.
Absolutely.
It's like there should be a company that helps out these people just do the things that they need to get done.
Right.
In this
But
case,
I think that's great that you guys are now kind of bringing, okay, here are all the clinics that you can go to for monitoring, right? Because this service really doesn't exist. We have this for IVF clinics, or you can use your, if your IVF center does remote monitoring, if they have a list, if someone's updating it, right? But you guys having kind of a standardized central location of, hey, this is where I live, this is my zip code, and I can look up and find a monitoring provider that is backed by you guys. I think that's a great service. And just as IVF expands, is something that's really needed.
Yeah, and I can say the same about the monitoring package that you offer. This is actually very much what our members have been asking for. They want to understand better the. Are you echoing? Am I echoing?
No, hold on.
No, it's maybe from my side only. But the patients want to know the price for the monitoring and overall for IVF in total. So they don't want to have this extra charges that they have from this and that and that. And it's unavoidable overall with IVF, because IVF is so much customized. Do you want to do PGT, fresh transfer, frozen transfer, whatever it is? And if they can get at least a peace of mind in terms of the monitoring, how much they're going to pay is definitely added benefit. We also try to suggest our monitoring facilities to offer a la carte. So one ultrasound if needed. A lot of women actually do want to do the remote monitoring just because they're traveling, and there is no option like that right now. They have to find it on their own on Google. So it's definitely can be helpful to have the package and separately ultrasound and blood work itself. So what type of feedback have you had? I know that a lot of women are raving about the IVF monitoring. Have you heard anything else? What do they say, how it's been helpful? What type of feedback from patients do you get in terms of how you bring convenience and effectiveness? What else do the patients say?
I mean, I think the main thing is that they don't have to go spend a few weeks in another city, to do monitoring, which is, a huge impact on somebody's life. Most people can't just get up and do that. Whether you work from home or not, you have hotel costs and food costs and travel costs. So, that's just not feasible for most people. The majority of our patients before they were doing remote monitoring were also going to radiology centers, who the majority of their technicians are not well trained specifically in follicular studies. So they were going for an ultrasound. They were having to sit in a waiting room with a ton of people who were getting other imaging scans done, and they weren't getting a great ultrasound necessarily. And then they're having to go to LabCorp or Quest and sit there in a waiting room with a ton of people and do a walk-in. And so, you're taking hours and hours out of your morning to potentially not even have the most accurate results. So being able to be a one-stop shop for people and know that, we prioritize them, basically, like if they get their period on Sunday night and our office is closed and they need to come in Monday, we will see them. And we do our best to squeeze these patients in. So I think that peace of mind that if they walk in at 7 o'clock on Sunday, we will see them. They're not going to be able to do that for a radiology center. And, you know, if you walk in for a lab appointment, you're going to be sitting for multiple hours. So I think the one-stop shop and the mental security of knowing that they will be seen and they will be getting accurate results is a huge thing for them. You know, our patients are so, so grateful. And I've had patients drive from far. Like I've had a patient from West Virginia. She was driving to me like 3 hours. She would wake up at 4 o'clock in the morning, leave her house at 4:30, would be to me by 7:30 and have to drive home. But even that was closer than any other option that she had. So she was even grateful. So the vast majority of our patients have just been, I mean, we haven't gotten much negative feedback at all. They're just all so appreciative, really.
But I'm so glad to hear that. That's amazing. For you, what other considerations that somebody who might be thinking about IVF monitoring? What are the considerations that you might want to bring up? So something to be aware of. Did something not go as smoothly as you would expect?
I guess the question is like, you know, they should look at why do they want to do it? Is this a population of patients they're interested in? Do they have the infrastructure in place? Do they have ultrasounds? Or if not, can they obtain an ultrasound? Are they someone who's comfortable with ultrasounding themselves? If not, do they have the means to hire a sonographer? You know, depending on where they are practicing, you know, we're lucky in that we're in an urban area where, you know, we have phlebotomists on site. And if not, we have a patient who can drive to a LabCorp 5 or 10 minutes away. But if you're in a rural area, what does, you know, the phlebotomy, you know, situation look like for patients? So I think kind of just looking at, you know, why and what's the feasibility and what's the end goal. You know, we just kind of started this as like a beneficial service to our patients because people were desperate and needed it. We wanted to be of help, but, you know, it's really turned into something bigger. So, you know, what's the end goal? What's the purpose for you offering it? Just kind of asking yourself these questions. And do you have a good support network in place? You know, again, we were lucky in that we partnered with some great REIs who, you know, if I have a question, I can call on them, you know, really easily. But if you don't have that, you know, it's, you know, who do you go to if you have a question? So just, I think asking yourself those questions. And if you can, you know, again, I'm happy to talk to whoever, and I love to talk to other folks in the industry. I think, you know, fertility is such a small industry. So I'm always happy to create relationships, but, you know, having like a support system really through it, who can kind of guide you and walk you through it, is something that's really helpful and valuable.
Yeah, passing on the knowledge that you got, and it's making the fertility more affordable too, which is pretty amazing. Your pricing at Annandale is pretty affordable. I'm glad that you're doing that too now.
Yeah, we charge $49.99 for egg freezing. And, you know, in our area, there's a huge number of women who really need egg freezing, you know, who work on Capitol Hill, and doctors and lawyers and women who are really delaying childbearing to, you know, put their careers first, which, you know, I've done myself. But so we charge $49.99 for egg freezing. And our price for IVF is somewhere between $7,000 and $10,000, kind of depending if patient needs fresh or frozen transfer, depending on their medical situation. But yeah, again, like we need to pay our bills and cover our costs, but, you know, we're not in this to make a bajillion dollars. And I think that the way that the fertility industry currently is operating is not going to be feasible long term because the demand is so high.
Mm-hmm. I guess we can wrap up on this. Is there any last advice or any call to action you want to bring up to the audience? And if anybody has any questions, please send your way to the chat as well.
I think just my last thoughts would be, if this is something that you're even interested in, you're kind of on the right track. This is a hugely growing specialty in medicine, and it's just going to keep growing and growing as our population ages and gets more unhealthy. So having services like Blooming Eve that can kind of standardize the process are going to be really important for these patients moving forward. But again, like, you're doing such an amazing thing for people, even just doing monitoring. Even if you're not doing the IVF, you're providing a really important service that patients need to do IVF to then have their family. So, just even considering it, I think you're on the right track, and it's financially beneficial, it's fulfilling, it's pretty easy. So, we're all for it. Our practice, I think, has really benefited from it. And, now we have an IVF center from it. So, yeah, it's just been great all in all.
So amazing. It's a true success story. Thank you so much for sharing your experience. And to summarize also, what do we offer at Blooming Eve is that we will be consolidating all of the monitoring facilities in one place, so that fertility clinics on the other side who want to start this remote monitoring program can connect to the monitoring facilities, so through us. So we're intermediary that facilitates the operations between the two parties, and our core offering is that we are standardizing the process and helping patients understand what do they need to do in each step of the journey, and also ensuring the documentation, the order forms are sent on time. So it's going to be standardized both from fertility clinic side and the monitoring clinic side. And if anybody on the call is interested to learn more, definitely book a call with me, and we can share more information. It's free to sign up, and we are not charging anything, monitoring clinics, because you do an amazing job to just start offering this. It's very much needed. And if you have any questions on how to start the process, we are here to help. I didn't see any other questions in the chat. If anybody has questions, let me know, or we can continue conversation later on, and we can cut it short today. Samantha, thank you so much. Any last words of wisdom?
If anyone is interested in learning more about our company, it's Annandale Fertility. So you can go to www.annandalefertility.com. Our Instagram is @AnnandaleFertility. And Anya, I don't know if you have a recording after, but feel free to send out my email, my contact information. But I'm Samantha Stern. I'm the CEO of the company. And my email is Samantha@AnnandaleFertility. We tried to make it very easy to contact us. So thank you all for listening, and thank you to Anya.
Yeah, thank you all. Have a good day.